My name is Allie Orwig, and I'm with the Indiana Rural Health Association. I run the Lunch and Learn initiatives that are typically 45-minute to an hour presentations over the noon lunch hour. Really excited to have Joanah Wischmeier with us today to present on her excellent project. But before we get started, just a couple quick housekeeping items. If you do have questions, you have a couple options for asking those today. If you hover your mouse over your screen, depending on which view mode you're in, some options will pop from the bottom or the top. I will try to keep an eye on those and act as moderator for Joanah, but you can use raise hand if you would like to ask a question verbally. We can unmute your line. You can also use the chat or Q&A functions to send in your questions. And again, I will try to keep an eye on those for Joanah as we go along. Joanah, I should have asked you at the top of the hour, do you want to take those as they come in, or do you prefer to hold them to the end?
I'm very flexible, so however you feel when you see the question come in is fine.
Okay, all right. Well, with that, I think that's everything I needed to cover. We are going to record today's session, as I said, so if you're unable to join us for the full hour, or if there is someone you think should really have seen this presentation, it will be on our YouTube channel early next week. So we encourage you to check that channel out anytime. Lots of great presentations on there, but I will go ahead now and turn it over to you, Joanah.
Okay, thank you, Allie. I hope everyone can hear me. Again, my name is Joanah Wischmeier, and I am an RN. I work for the Indiana Rural Health Association. I began in April of 2019 at the beginning of the Healthy Start initiative. So I'm the program director for Healthy Start Communities That Care, and we primarily serve Davies, DuBois, Greene, and Martin counties in Indiana. And very recently, I've also been asked to lead the IRHAhelp. So I'm the program director for that as well, which is what our presentation is going to be about today. So like we said, if you have questions, you want to put them in the chat, that's fine. And then Allie, feel free if it's a good time just to interrupt me and I can answer them, or we can wait till the end. Either way is fine. All right, so we'll begin. This is, again, IRHAhelp. This is a collaborative community resource. And, oh, already went too far. Sorry about that. So I first want to mention that IRHAhelp is powered by Aunt Bertha. So hopefully some of you, if not all of you, have heard of Aunt Bertha. However, this presentation is going to really focus on IRHAhelp, but we have to give Aunt Bertha a little bit of credit here because we do have a customer representative that we work with at least monthly, if not more than monthly. They're there if we have any questions, we reach out to them, and we have worked with them for quite a while now, specifically to get the IRHAhelp website up and running and really make it very useful for IRHA, all of our members, all of our partners, and really for whoever wants to come through this website and find an easy online platform for community resources, referrals. It's very useful. So just to kind of show you the Aunt Bertha website, if you think, well, I'm not really sure, but if I saw the website, maybe I would know if I've used it before. This right here is the Aunt Bertha website. So it's really findhelp.org is the Aunt Bertha website. So maybe you're thinking now, oh yeah, I remember typing in a zip code and using this resource before. So that's what this looks like. But we're not going to focus on this part. We're focusing on the IRHAhelp piece. And it too is really aimed to provide free or reduced cost direct social services. So as you are working with patients, participants, those in your organizations, or trying to educate someone else on the resource, this is very specific to free or reduced cost direct social services. And we'll touch on that a little bit more in a minute. So it is a collaborative resource tool to ease the referral process for those facing social needs. It really helps to assist users in requesting and scheduling appointments, and depending on how the organization has listed their information, there's different ways that you can use this site. And the wonderful thing is it's available in 100+ languages. very beneficial for Healthy Start. We have a lot that we have to educate in Spanish, and we're becoming more and more used to having to also use Haitian Creole. So this has been very advantageous to our partners that's available in 100+ languages. And we'll look at that here too in a few minutes. Okay, so why use IRHAhelp maybe rather than just Find Help or the Aunt Bertha site? So we encourage you to use IRHAhelp because it really helps to identify needs in our area in Indiana. And you can identify needs in a lot of different ways through this site. You're able to search by the category of need. You can search by zip codes. We'll go through all of that on the website, but it really helps to identify the needs in our communities. And an example that I have is through our CAN group through our Healthy Start programming. It's our Community Action Network. We bring all of our 4 counties together, and it really shows across our 4 counties what is the biggest need. We focus a lot on that. So this resource is so useful when we look at the back end of data. We can really pull our specific counties out. If you're using the Aunt Bertha website, at large, that is a lot harder to drill down to certain counties. Now that we've developed this website through IRHA, you can really focus in on the counties that are the areas that you work in and that you're concerned with and that your patients come through. So the coordination of care piece, all the resources come together in this one easy to use platform. We'll talk about here in a little bit how you can add resources to the IRHAhelp website to even make it more robust than it already is and make sure your services are highlighted as well. And then the data tracking. This is very useful. Like I said, we can actually go in on the back end of the IRHAhelp website, and we can look at what categories are searched the most, what zip codes are searched, what are people specifically looking for? Is it transportation? Is it mental health needs? And that's information that you can take back to others in your community. We take it back to our partners and let our partners know this is really where you're helping your participants at the most, and it's really just a great way to know where the needs are and how you can better assist. So I do want to add that once I was asked to be the IRHAhelp project director, I asked the lead data coordinator at IRHA, who also serves on our Healthy Start initiative. She is so knowledgeable about data analysis. So I've added her to this team, the IRHAhelp team or committee, so she can really start to dive in and do a lot more of that data work for us to really, have a good, solid understanding of the data piece, how it works, and maybe, how we can use that even broader and do presentations on that piece in the future. So here is a snapshot of just a little bit of the data, and I know it might be small on your screen, I'm not sure. But here's 2 different areas. There's a pie chart, and then there's just like a prioritizing chart here that shows just, and this was over the last 90 days, and we screenshotted this probably about a month ago. So, and also I want to inform you that it says the last 90 days, but it really wasn't. It was about 30 days from when we actually started really using this to when we screenshotted this picture. So this gives you a really good insight into what people are currently looking for that's using IRHAhelp. So you can see on the pie chart, like 25% is what this says, looking for housing, 23% are searching for food, and they're searching by category. So they are searching, they're typing it in, or they're looking under icons that you'll see on the website link that's searching by category. So terms is a different way that you can search on there, and food pantry comes up 86 searches for food pantry. So with 86 searches for food pantry, with 23% of those utilizing the website searching for food, you can see that rises to the top. And many times through different community groups, through anything that you hear, any kind of conferences, food insecurities are a huge need, especially in our areas. So this, I think, just goes to show that that's what people are in need of. Food, housing, transportation fell a little bit lower than I would have expected, honestly. but here's specifically what is being tracked as of the last month or so on our website that people are looking for. Okay, so I mentioned suggesting a program. So if you're sitting here now thinking, oh, my specific program is something I want to list on here, or say you work for an organization where you think, I know so-and-so that has a program that maybe wants to list on here, you can absolutely do that. So this is a screenshot off of the website where you can suggest a program. So you would fill out this form or ask, a coworker, whoever is running that program, to fill out this form. Very simple, the program or the name, the state that it serves, phone number, website link, that information, and then you will hit the suggest button that I will show you. This will actually go to Aunt Bertha. So like our customer representative will get a hold of this information. They first check to make sure that this is not already listed and it's not a duplicate. And then if it is a duplicate, I believe that they contact you to ask if you want to claim the program, or if the person who's claimed it is still like head of that program. And I've asked this question before as it's came up, more than one person can claim a program if there's several of you that work with it. But they just do this to make sure there's no duplication. They also do this so they can look at the program to make sure it truly is free or reduced direct social services. It has to fall in those categories. They've been very upfront that like support groups are not something that are put on this type of website, Aunt Bertha or IRHAhelp. It has to truly be a direct social service, free or reduced cost. So, if you have programs, I encourage you to suggest them, and you want to suggest them through the IRHAhelp website. So then they will fall to that website. Aunt Bertha and IRHA website have a lot of the same information, but I will also let you know, as this question has came up before, that if a program is very specific to Indiana IRHA, it will be listed on the IRHA website. They may not list it on Aunt Bertha, because we're encouraging everyone, members, all of those that we interact with and all across our state, to use this website. So this is a good way to make that our program and our online resources more robust, is to suggest programming. Okay, this we have just recently added to this PowerPoint. This is also just a way for you to see what that's going to look like. You can access the website, the IRHAhelp, from your laptop or your mobile device. This is what it will look like when you do, and I'll show you how to do that as well. But I think this is very key for those who work with participants directly. I know for our partner staff at our hospitals, they do a lot of home visiting. They take in their Surface Pros or laptops sometimes. Sometimes they just have their phone to help a client. So this is a good visual of what this looks like. And although it's not an app, and I do want to mention this question has too come up before, Aunt Bertha or the Find Help does have an app. However, IRHAhelp does not currently have an app, although we're looking into that. But the IRHAhelp website is very mobile friendly. I've used it like this, and it works very similar to an app. Okay, if you want to jot my information down, you're more than welcome to. So I can try to answer most questions regarding IRHAhelp. If I can't, I can reach out to our customer representative and get you an answer. But this is my information. And then we will go straight to the link to the website to just kind of peruse through it a little bit and see what it looks like. So any questions so far before we go into this?
We haven't had any submitted yet, but
Okay.
I am taking a look right now for any raised hands, chats, or Q&As that come in.
All right, so this is what your IRHAhelp website looks like. And I do want to mention, I think I have it pulled up here. So this is the exact web address or link to get. It's IRHAhelp.auntbertha.com. Now, if you go straight, I think I have this right here. Okay, if you go straight to IndianaRuralHealth.org, our website, and you go to resources, You will also find this under resources. You can hit the IRHA help. And you can scroll down here. There's a flyer that you can download, or you can link in directly right here as well. Now, I'm going to download the flyer really quickly. So when you see this flyer, there's a QR code. You can hold your phone camera up to that, even on this screen, and it will link your phone straight to what we're getting ready to go through. So if you want to try it on your phone by putting your camera up to this, you're more than welcome to do that as well, to see how you can use it off of your phone. So several ways that you can access this very easily. Okay. I'm going to assume if you want to use the QR code, you have it. If not, let Allie know. All right, so I'm going to go back here. And does anybody want me to put in a certain zip code for them? If you do, you can unmute and just tell me what it is. If you want to look for something specific.
You can use mine, Jonah. You can do 47882.
Okay, 47882. So then you'll hit search. Sullivan, Indiana, there's 1,614 programs listed specifically on the IRHAhelp website. So, Allie, what do you want to look for? What are you interested in?
How about neonatal or perinatal or gonna have a baby?
You're gonna have a baby. So we'll just try perinatal services. So we're gonna search that. And sometimes this does take a minute. There's a lot of things it has to go through. Okay, I have to move something here. Okay. So you're looking kind of broadly at perinatal services. So this is going to give you a lot of different things. So you can look down through here, FSSA information. There's the Hope Line, Crisis Line, and Text Line. A lot of times these are used a lot on a website like this because many people use this type of website when they're more in a crisis situation, they need help now. So this is really good information to know because if you have someone like that, you can click on the more info. It's available for anyone can access this program. So a pregnant mom, that's why it's come up. They will even assist, pregnant moms. Anyone can assess the program. There's a crisis line, there's a text line. You can offer referrals. It looks like it's pretty easily accessible. Hours of the day, days of the week. So it's going to go down and kind of explain. They've put a lot of information in here. And it looks like they will only be able to help you in English. Now, resources on this website, you can get in 100 different languages. But if you're using them as a referral source and you're texting and talking with them on the phone, it looks like they're going to have to speak English. The cost is free. So it looks like you can call this phone number. You can look at their website. They have a Facebook, they have Twitter page. So I'm going to scroll back up. Don't want to make you dizzy, but when you scroll back up, you could hit next steps. So I'm just going to hit next steps on this one. So they want you to call them. The best way to connect is to call them. Or if you're helping someone else, you can log a referral. So I'm going to hit log a referral. Okay, so it tells you the form below is not sent to the program. It sends you basically to next steps to contact this program. So what you would do is if you're, and this is what I've told my partners, and I'm just going to be very transparent that I have this question out there to Aunt Bertha. So in a situation that we've come across, and I've had one of my perinatal navigators ask me, is they are typically referring someone else, right? So if they hit, I'm referring someone else, you put in your name as like the perinatal navigator. So I would put in Joanah Wischmeier, my email address. But then it says, tell us about the person you're helping. So the perinatal navigator asked me, do I need to have a consent signed that I'm putting their information in here to help them? I said, that's a very good question. So what I have currently recommended until I hear more information is to really encourage them to self-refer themselves at this time. You can print off this information. They can hit this, they can refer themselves. But what's going to happen if you refer them, then this program is going to contact them either by a text, by a phone call, by an email, however you've set it up in here. And is your patient or participant or client really okay with this? So, and I know with myself being clinical, with the program that I deal with, very clinical based, we have to be very careful about that. So I'm asking those questions. Do we need to have them sign a consent at the time of visit that we can refer them through the IRHAhelp website? Until then, like I've said, I've asked them to encourage them to refer themselves, or do we at least sit down side by side with them and not just do it on their own time because they were identified as high risk. So just a little bit of extra information there. But however you see it for yourself or your program best doing it, you can refer for yourself, your family, others. And a lot of times the roles we're in, we're going to be referring for others. So that is one example there of if you have someone more in that, meaning the crisis line or a text line for more of an emergent situation. All right, if we go back up here, I know this is one, so we're still in Alley zip code, we're still in Sullivan. I'm going to put in mental health counseling. I know this is a big one that our program uses a lot, this website for. Okay, so mental health counseling, you can always look over here. If you can see my mouse, I'm not sure if you can, where it says the location. So we're in Sullivan. So this is something available in Terre Haute, so not terribly far away. It looks like they have a mental health therapist and what they're focused on. They are for children, adults, and couples. So they serve, here's all of those that they serve: adults, young adults, teens, children, seniors, unemployed, low income. You can look at your more info again. This is where you can print if you want to give this to your client. They have availability. They've mentioned that. Everything that their services include. Looks like they mainly speak in English. Cost is sliding scale. So they're going to do some type of assessment to see, you know, the client's income and where that kind of falls on their fee of their sliding scale, but obviously would be at a reduced cost. They have a website, Facebook page, and it talks about right here, it covers residents, Sullivan County. That's why it's rose to the top of the list. A map of how to get there. Then if you want to refer, there's always this next steps button, or sometimes it will say like send a referral or log a referral. And it's going to be the same thing. They have a phone number they want you to call, or you can do a log a referral. This is to how it's sent in the same fashion. So if you want to just click one of these icons, if this is easier, you can hit the transit. We're still searching Sullivan. And let's say we want to help pay for gas. Who can help them pay for gas? And what does that look like? I will tell you that as much as I've used this website, Travis Burkhart Foundation comes up at the top every time. This one right here by Mercy Medical Angels serves nationwide. This one serves our state. I don't know, Allie, if any of these look familiar to you that you're familiar with in Sullivan. But how you can do this, we'll go back up here, serves your state. We'll look at the information. Okay, that's what I was wondering about because it was through hemophilia. You must have a bleeding disorder to be able to use this one. So it tells you that upfront eligibility. So you're like, oh, well, that's not going to work for my client. So you go to a different one. So this one, you have to be traveling at least 50 miles. It's not going to take you to the office 5 miles from your home. It has to be at least 50 miles from home to treatment facility. It looks like you have to have proof of income, other documents. I mean, this website shows you everything that you need to do, depending on what you choose. And they each have a next steps button on how to truly help someone. So does anyone, well, I can go into some other filters that they have. So personal filters, you can use anything. If you have a teen, we're going to go with a teen. This takes me a minute, so just bear with me. I typically hit a teen pregnancy because that's what we normally do for a program, but I'm not seeing pregnancy, and I don't know if you guys see it. It's normally on here. Allie, do you see it on here?
No.
I don't either, and I normally do.
We just don't have pregnant teenagers in Sullivan, that's all.
Well, I'm guessing that must be the case. Well, let's hit young adults and see what happens. I don't know. And I have found some little glitches in the system, I'll be honest. At times, their button to change it to different languages is not working. So there have been a few little things like that that we've had to address. So we're just going to say young adults, low income, underinsured. And we're just going to filter it and see what we get. I mean, you really just kind of have to play around with it on your own. So here comes different like financial assistance. So you can search in that fashion. And then when you want to clear all searches, you can clear that. Program filters is another way. Do you need something that's open late? Maybe we find that a lot with the fathers in our program. They work late, so they have to get, you know, services at a later time in the day. And then there's also income eligibility. How many live in your household? How much does your household make per month? You can filter that way to see what services they're eligible for. All right, now let's go to select a language. We'll see if this is working today. Let's go to Spanish. You have to hit the arrow. Okay. This is, I had a meeting about this last week and it got canceled. So we're meeting on it next week. For some reason, it will not do this on my device, but it will on some other devices. So this is a device that it will not transfer over to Spanish. I'm not sure why, but you should be reading all of this in Spanish if it were working correctly. So that is something that we've noticed that we're working on them with. If you go to the findhelp.org website, it typically works. It's because this is a newer website. There's some kind of glitch in it that they have not completely figured out yet. So just to make you aware of that, but that should go to Spanish. All right, any questions on any of this? We're going back to English, even though it never changed. We'll put in Terre Haute zip code. So it will continue to search in the zip code you put in until you put in a new zip code. So if you go to the Terre Haute and you want to see about food delivery, this serves the local area. It serves adults 18 and older. So there's several different ones here also. So you can really find whatever you're looking for in some way, shape, or form. So does anybody want to see anything else? And I can kind of toggle through here and just show you some different things. You can look if you're trying to help with any kind of daytime care, end of life care. One thing I will mention, and I'm just going to use Memorial as an example. I had a meeting with my team at Memorial Hospital and Healthcare Center out of Jasper yesterday, and they were looking for some mental health counseling in the area. And every time they put it in, it wasn't populating, and they knew they had within their own hospital system, it should be populating. So we just typed in Memorial Hospital and Healthcare Center, because they knew they wanted to send their participant to the one at Memorial. Oh, I don't have their zip code in here. And it'll take me a minute to look up their zip code. So I'll look that up and you ask me any questions if you have them.
Still don't see any questions coming in. Again, you can raise your hand, you can chat, you can use the Q&A function. We will address those.
Okay, so now that I'm in Jasper, Indiana zip code area and I type in Memorial Hospital and Healthcare Center, then their different services pop up now. It's like if you're looking for their specific diabetes support group. Now this support group is in here because it is through the hospital and it truly is a direct social service for your reduced cost. So if you're looking at any of this, then you are now kind of the owner of the program or leading the program. And you notice over here on the left side, it says notice out-of-date information or see a program you work for. You can click suggest. You can claim the program listing. You can suggest an update. Say you notice that a phone number is out of date. You can click that suggest and suggest that they update something within that profile. And then they'll be in touch with you directly, the Aunt Bertha representatives, to make sure that those are fixed and everything is up to date. So I encourage all of you, if you know you have something listed on here or think you may, to check and make sure everything is truly up to date. So anywhere you see a suggest button, it goes directly to Aunt Bertha for them to be in contact with you. Okay. I'm going to stop sharing for a minute here just so I can see anybody.
Okay, any other questions? Anything you want clarification on? Anything you'd like Joanah to go ahead and go over again or pull up on the website? Raise your hand, we'll unmute your line. Use the chat function or Q&A if you'd rather type in a question. I think it was a really nice presentation, Joanah. I certainly understand how to use the website more and I've been on it before. So It
Well,
was
I
really
still learn
good
every
to have
day,
the
honestly.
walkthrough. Yeah.
And anything, Allie, that you're thinking of that I forgot to cover?
No, I think you did a really nice overview. Especially good to know how to submit for changes when so many of our partners are definitely going to have these services.
Mhm.
Okay, well, I am not seeing any questions come in, so we'll go ahead and just thank everybody for their time today. Thank you, Jonah, for the excellent presentation. And
You're
again,
welcome.
we will have this on our YouTube channel early next week.
Okay, thank you all. If you have any questions, reach out, let me know.
Thanks, Jonah. Bye-bye.
Bye.